Ebola scare hits home. A patient who spent time in West Africa is being treated at the University of Kansas Hospital with symptoms consistent with Ebola.
Right now, KMBC9 Scott McDonald tells us the hospital considers the patient low risk, but it's still taking major precautions.
Laura Len, this man was a medic working on a commercial ship in areas of West Africa, actually in the oil industry. He was treating patients who are in areas where Ebola is persistent right now, and currently he's the one being treated at the University of Kansas Hospital behind me. He's in an area now being called the Black Zone. Full infection control was put into action this morning at the University of Kansas Hospital.
We put on impervious gowns so that if there was any blood or body fluids, it would not get onto our clothes.
The male patient called ahead this morning knowing he was at risk. Was immediately taken into one of the 3 isolation wards, complete with double doors and a negative airflow room.
He felt so wiped out that he decided to come in and be seen with the concern. Of course, he's well informed, and again, as a medic, he's trained to think about these things. He came to us with these concerns, plus he's had significant weight loss.
A team of 6 caregivers will tend to the patient who right now isn't showing some of the more glaring symptoms of Ebola. They'll work in shifts, keeping contact to a minimal.
If we had to hazard a guess, which we're always a little reluctant to do, I'm hopeful that he doesn't have Ebola. I think it's quite likely that because he was exposed to typhoid, that may be the lead candidate right now in terms of the disease process, but it'll take a little bit more time to sort those things out completely.
2 spots right now to test for Ebola in the United States. Samples will be sent to both those medical facilities, and they expect the results to be back sometime tomorrow between 5 and 6 p.m. Laura, Len?
Scott, is there any concern that the patient may have come into contact with other people before he was admitted to the hospital?
Well, the patient at this point in time, Len, he's been sick for 4 or 5 days. We do know he took a commercial flight back to the United States. So that's a lot of time and a lot of opportunity to come in contact with other people and potentially put them at risk if he does have Ebola. And again, we don't know if that's the case right now. So health departments along with the CDC working together with other agencies to make sure nobody in our current area is at risk, along with those areas that this man has traveled through.